So the last couple of years, we have been very focused on establishing the current state of knowledge. So I published an article about 6 months ago that provides a new model for how to think about the disease. So in the old days, Castleman disease was considered to be a benign IL-6 secreting tumor, a disease where you had these tumors in your lymph nodes which released chemicals and caused disease. But actually, when you pull the evidence together, when I did the review of over 2,000 published cases, it became clear that the facts didn't support that previous model. Actually, the lymph node changes you see for Castleman disease are not tumors. They're actually reactive, normal lymph node changes due to cytokines being released. So whereas we used to think that Castleman disease was a tumor that released cytokines and caused disease, it's actually more appropriately an inflammatory disorder where those chemicals cause the lymph node to change. So what we used to think was the cause is really an effect, and that really has major implications for treatment. So whereas before, when an anti-IL-6 therapy wasn't effective, we thought our only option was cytotoxic chemotherapy because we thought of it as a tumor. But actually, if you think about it as a hyperactivated immune system, then you can interrupt that with an immunosuppressant or an immunomodulator. So we're really hopeful that this first step will provide a platform for moving forward. But so once we figured out what is our current state of knowledge, you can't figure out what to study tomorrow unless you have a good grasp of what you know today. So now we know what the state of science is today, and from that platform we've been able to identify several studies that we think will help to advance the science. So one of them is a viral discovery study. So it sounds a bit science fiction-y, but actually you're able to search for new viruses that have never been discovered. Maybe the immune system is triggered by some virus that we've never seen, that we've never identified before. So that's one hypothesis. So viral discovery is one of our priorities. Another priority is serum proteomics, where you're actually able to quantify over 1,000 proteins in the blood. And so we're able to look at blood samples of Castleman's patients to quantify and compare to see if we can better understand what is it that's triggering the immune system and what are the really important chemicals that are involved in it. Another study is an intracellular inflammatory pathway study where we're using immunohistochemistry to identify pathways that may be activated in the disease. Again, as we think about it as an inflammatory disorder, we need to figure out what is causing the cytokine release, and the answer is in the cells. So the last thing I would mention, or two last things, is that if we want to do this research, we need tissue samples. In order to move science forward, you need a good idea, so you need the right plan, you need tissue, and you need money. And so we're working on all three in parallel, but we've got the ideas, and now we're trying to move forward to get tissue. So I'd say maybe the fourth initiative that's important is collecting tissue samples to make this research happen. And so we're giving patients the power and physicians the power to move science forward by saying, join us, contribute your tissue, be a collaborator in our studies, publish articles with us, but we need tissue to do it. And then the fifth study, you can tell we've got a lot on our list that we're really excited about, but number 5 is building a patient registry. So we've recently secured a commitment to fund a global patient registry. And so this will collect data on patients from around the world so we can start to understand what are signs of a relapse, what are the kind of symptoms we need to be tracking in these patients. And then the last important priority for the year is to maybe this is reverse order, but it's to develop a diagnostic criteria for the disease. So it's hard to believe, but multicenter Castleman disease doesn't have a uniform diagnostic criteria. It's a diagnosis made after a pathologist sees particular features in the lymph node, and then that patient has symptoms that match the typical Castleman's features. But there's no checklist, there's no Castleman criteria, and so by the end of 2015, we will have finally a diagnostic criteria.